My name is Dr. Jason Levine. I'm an orthopedic surgeon here at the Toledo Clinic, and I specialize in sports medicine and arthroscopy. So a lot of times people will have pain in their shoulder and they're not exactly sure how it happened. Sometimes it will be from a trauma, but other times it just comes on and they don't really know exactly what happened. That pain is often occurs when they reach their arms up overhead, when they try to lift objects up from the floor, or sometimes just when they sleep at nighttime they'll experience pain. And oftentimes it doesn't get better when they take anti-inflammatory medications such as Motrin or ibuprofen. They'll wait it out or try to do some exercises, and then that's when it doesn't get better, that's when it'd be time to come see me. So after they come see me, I'll do a physical exam on them. Part of the physical exam is just to see what their strength is, to see what their range of motion is. I'll ask them questions about how long it's been going on and what treatment they've had so far. After the initial physical exam and questions, then I'll usually prescribe what we call conservative management. And usually that consists of anti-inflammatory medications, a physical therapy prescription, and then often an injection that I can do in the clinic. So usually after about a 6 to 8 week program of seeing if those conservative managements will be effective, if that doesn't work, then often they'll come back to see me and I would order an MRI scan. The MRI scan will then get a good look at that rotator cuff. So the rotator cuff are 4 muscles that are in the shoulder area, and they help move your arm and help rotate the shoulder around. And one of them in particular, the muscle called the supraspinatus, is the one that's most often involved in this injury. And if that MRI scan shows that that muscle or the others are injured, then we start discussing other options such as surgery. So after rotator cuff surgery, it is a very long, drawn-out process as far as recovery. The surgery only takes me about an hour to do. However, the patient usually requires about 6 months until they fully recover to the point that they're able to perform sports or go back to do heavy lifting. Initially after surgery, they're going to need to be in a sling for approximately 4 to 6 weeks. I usually start physical therapy somewhere around that time. They're going to be painful, sore, swollen, calling my office, concerned about, is this how it's supposed to be? But usually around that 3 to 4 month mark is when patients really turn a corner. And then between 4 to 6 months is usually when they get back to full activities. The reason that I do this surgery is to try to make patients or athletes get back to full activity. And the reason that they come to see me is because they're in pain, and hopefully by the time they don't have to see me anymore, that they're no longer in pain. At the Toledo Clinic, again, we have a fantastic facility here at our Outpatient Surgery Center. It's a very quiet environment, allows patients to come in and go home the same day. We have skilled staff and expert physicians here that are able to take care of just about any procedure that would need to have outpatient surgery.